The diagnosis is reached by measurement of the enzyme alpha-mannosidosis, which can be done in white blood cells from a blood sample. As an alternative, we can also do it with genetic testing. I think oftentimes when physicians think about a patient as possibly having a lysosomal storage disorder, they may send for a panel of lysosomal enzymes or a panel of gene for sequencing of a panel of genes that are relevant to lysosomal storage disorders. And this would certainly be an appropriate way to make the diagnosis, but it's always important to look at the panel of enzymes or genes being tested in the laboratory that you select to make sure that alpha-mannosidosis is included. These patients very often are seen by 2, 3, 4, 5, 6 different physicians before they ultimately get a correct diagnosis. And this may occur over a period of many years. Because these are very rare disorders, an individual physician may never have seen a patient in his or her career and may not be familiar either with the condition or with the type of testing. With infantile patients, a physician might suspect an MPS disorder, for example, because of the coarse facial features, and hepatosplenomegaly, and might order urine glycosaminoglycans, but those will be normal in patients with alpha-mannosidosis. So that won't be helpful in making the diagnosis. And if they're not aware that there are other conditions that should be tested for, then that patient could go on undiagnosed for quite some time. In the older patients, I think, of course, physicians see many, many kids with developmental delay. It's a very nonspecific symptom, and ultimately with intellectual disability. But if we also see some of the other manifestations, like the frequent infections, an immunoglobulin deficiency, or hearing loss, then that should trigger the thought that perhaps there's a connection between these findings. And honestly, I really believe that, you know, we can't expect every primary care physician to necessarily know every rare disorder that's out there. There are many. And, but I think what is important is for physicians, if they see a child or an adolescent or an adult who has 2 or 3 or 4 seemingly unrelated issues, to kind of take a step back and say, could there be a common thread? Could there be a unifying diagnosis that ties these things together? Because oftentimes there is, and then maybe refer that patient to a geneticist for evaluation. I think, you know, that would be the most appropriate step.